Motherhood Network community, we are so honored to share that our show was named one of the best of 2025 by Apple Podcasts. We cannot thank you enough for listening and joining us on our journey. And if you're new to the show, we recommend you check out a few of our favorite episodes, and we have a couple. We're also in good company on this list, so please be sure to check out the full of the best of 2025 collection and discover other amazing shows right now in the Apple Podcast app. Stay Nandi, much love. Nandi, the Motherhood Network, a platform you deserve. Are we rolling?
Are we rolling?
Okay, action. Today, we sit with a powerful development leader whose work stands on justice, dignity, and lasting community impact. Chiedza Chagutah, which means light, and she truly is a light, is head of programs at Soul City and is an advocate for driving global health equity, HIV prevention, social investment, and community-centered empowerment across Southern Africa. Chiedza, thank you so much for joining us on the Motherhood Network. Thank you.
Thank you so much for having me, Nandi.
You know, I wanted to find out, just from someone who's incredible like yourself, what inspired you to get into the advocacy space, but also particularly with HIV/AIDS?
I think one of the jokes that we constantly make, in the work that we do is if you're looking to get rich, if you're trying to, get a career where you're making the money, then this is not the work for you. I think the one thing that we all have in common doing this work is wanting to make a contribution towards the advancement that we want to see. I think we all dream of a better world, a better community, better city and neighborhood. And the real work where you get your hands dirty happens in this space. The work of, holding government to account, the work of advocating for resources, the work of thinking about what are the strategies that really work at a community level.
Yes.
Where can we make a difference in women's lives, in the lives of young girls? So for me, that really was the pull factor. As a Black African woman, there's so much that you see around you. Injustice, issues of access, issues of self-expression, and just, one being able to fully bring who they are to the world and color the world in that way. For me, that's really what has brought me into this work and what has kept me in the last 20 odd years.
You know, it's funny, for this episode, and I was hiding it here, I'm getting prepared to just revisit what was a very traumatic time for a lot of people, not just myself. For those who don't know, I'm from KwaZulu-Natal, KZN. And where I'm from was one of the worst affected regions globally regarding, new HIV infections. And so having to do this interview, every time we have World AIDS Day, it triggers not only myself, but so many people. I think of the era between 1996 and 2004 and how many family members I lost personally. I lost one of my closest cousins who used to live with us at some point. He was only 27. I mean, I just remember calling him, the last call I had with him. And he didn't want me to see him. because he didn't want me to see him in that frail state and being that sickly. And he wanted me to remember him, being this handsome, strong, vibrant human being. And so his dignity was taken away from him. And I honored that, the phone call. And he knew that this was the last time we'd be speaking. And the next time I'd see him was at his funeral. My aunt, my uncle, many people. I mean, anyone who lived in KwaZulu-Natal at the time. I'm from Durban. You would see whether you were going to town, just people. It was the first time as a kid, because I was 11, 12 years old when it really was bad. And you would just see death in front of you, and that trauma, whether it was people with shingles, meningitis. Our closest nanny got very sick as well, at some point. And the sweetest person trying to get on with the day, but there was just no medication, Healthcare workers, whether in my family or just in general, were saying we need ARVs, and there wasn't any political will at the time. So I think why it's such a trigger, not only for myself, but I'm sure a lot of people watching, is because I feel like this all could have been prevented had there just been a will to help others, And the reality is there's so many child-hated households, especially at the time. There's so many people who lost their parents. My cousin lost her father. She almost lost her mom, my aunt. I mean, we had already made plans that what is the way forward? Should my aunt leave? Okay, we'll take her. But these conversations where, people joke about I'm at 2K, and that's even a hashtag. But I don't think they give I'm at 2K enough grace. A lot of those kids were either infected by HIV/AIDS or didn't grow up with any parents or didn't know where to go, because it really changed our lives in such a traumatic way.
Yeah, and I suppose, I like where we started around it, around how far we've come, because there's a lot around dignity. Because you come out of a period, we come out of apartheid, and that was the fight, right? We're fighting for dignity of non-white people, Black people, brown people. And then it's like you're jumping out of the fire into the frying pan. And that dignity is taken away by something that, as you say, so preventable. Access could have, reduced the trauma.
Yes.
When we speak about dignity for Black people in South Africa, the issue of social protection, accessing medication is a huge milestone. Yeah, it's a huge milestone. We are far ahead. We are still far ahead of many African countries, many countries in the global South. So there's a lot to celebrate. Of course, there's more that still needs to be done, but I think starting from that point to say there's a lot to celebrate. And I think as we go into the conversation, we can talk more about the issues that you're speaking to around, HIV, AIDS was just equal to seeing someone walking around like a shadow of themselves. And that's not the case now.
No.
So we've really come a long way.
In fact, that was my next point. And thank you so much for saying that, because, for the most part, everyone looks healthy. People have their dignity back. They're empowered. It's just beautiful to see that people can live the life they want to as well, that there's a solution, and there's not this death sentence you have to face every single day. And we're going to go through it from a medical perspective, because to just our viewers watching, what we want from an episode like this is for everyone to feel empowered, to feel they can navigate what HIV/AIDS is, to also feel that they are seen if they've been affected by HIV/AIDS as well, you know. And so let's talk about the journey, you know. We speak about the political will, but with that was medication, obviously, ARVs as the acronym. And the early 90s, you know, that's when HIV drugs were introduced, but that was more private sector, you know. Very few people had access to such. And later on, let's say 2004, people still were taking, 10, 20 pills. It was a lot, you know, one day having to take that many pills, you know. And just seeing how that would affect a person from a physical perspective as well, because HIV and the medication sometimes didn't work so well. Lipodystrophy, is it, where that would happen, where some people would, you know, be affected, like, as we said, physically from an aesthetic perspective as well. And then that progress with combination theory, you know, it was around three drugs, and that was a better way to stop the virus and prevent resistance. But just speak about that era in terms of how far we've come. I'm going to continue to, obviously, when you go into the single tablet, a singular tablet now, and those regimes. But just to speak about where, you know, a person had to take so many pills a day and that affecting them. I know it affected my aunt and how she ended up changing, you know, the way she looked. And I know it traumatized her a lot, but she was trying to survive for her child. But what was that like, you know?
So I think the issue of access was, I suppose, only one win. And the tragedy, I suppose, was at the beginning the lack of recognizing that it wasn't just access, that HIV is not just a health issue, it's a social issue, it's an economic issue. And so when you still needed to take, for you to actually get those 20 tablets was, yes, a win, you tick that box. But there's so many things happening around it. Those 20 tablets your body doesn't take that particular brand of medication well. And so it then presents other side effects, like you're saying, then that people start to change, you know, the way that they look. They have other issues that they have to deal with, skin rashes, you know. It was a lot. But now think about it from the perspective of someone who's in Ilembe district, right? In KwaZulu-Natal. And it was not every hospital, every clinic that was dispensing the medication. So you've spent hundreds of rands to go see the doctor after waiting for a long time. And now that medication, your body is essentially rejecting. So it means you must go back with what money,
Sure.
with what time, with what healthcare system that is already under pressure. Because remember, at the time, yes, there was HIV, but there was a lot of other health related issues that were happening at that time, and developments, because now a lot more children had access to, you know, immunization, vaccinations. Women would now get, you know, a lot more access to family planning and, you know, just other health screening. So the healthcare sector was under strain. And now there's an added issue of you needing to now find what medication could better work for you. So I mean, it's you have that, and you're still dealing with issues of stigma. You still have to face your neighbors, your family, your spouse, who is refusing to go and test for HIV. Often at that time, one of the things that was the narrative was that the face of HIV was a Black African woman's face. So if you talk about AIDS that was taking people's lives at that time, it was a Black African woman's face. So you see a nation bedeviled by a triple burden of one, there was a lot of poverty still amongst Black people. There's a lot of violence that women, that was a scourge amongst Black African women.
Yes.
And then HIV and AIDS on top of that. And so it was the medication that was being advocated for at the time. And we've, like you said, we've now moved from 20 tablets to the one. In fact, I mean, we will talk more about, the other developments that have
Yes.
happened,
Yes.
and which is exciting. But I think for me, that recognition around the triple threat, which it still is, it might not be poverty, but there's definitely a big element of economic vulnerability that compounds what is already, what was already a challenge.
Well said. That's so true. And it's funny. I have this image, and I'm sure a lot of people may remember this, where people were so desperate to get their relatives or loved ones to the clinics. This is once ARVs were introduced. And there's like a wheelbarrow system where you try get them, to the clinics, because like you're saying, finances are not available. It's not there. There's a certain way you need to eat, your diet, and so you're right, from a holistic perspective, there was so much that wasn't taken into factor. Well, what does this look like? It's not just the medication as well. From a lifestyle perspective,
Yes.
what does that look like? My heart goes out to every single child that was affected by HIV/AIDS. I remember my cousin. The feeling of not knowing if your mom is going to survive or not, knowing your father has passed on, that level of anxiety every day, and it reminds me of a film that reflected such and so well yesterday with Leleti Khumalo. And that film really was a true reflection of what was happening, in the country for so many people. But again, there has been progress made, and that's why we'll then continue to speak about, as we said before, the single tablet regime then gets introduced, which was just a game changer. 1 pill per day, Again, helping people just from a practical perspective, being able to take their medication the right way. And that's then, so that's 2010. Then we look at 2020 to 2025 now, where there's newer long-acting medication. South Africa has been celebrating the new news of just having lenacapavir,
Yes.
which is such a game changer. That's going to be introduced April 2026, I believe.
Yes, so it only becomes available 2026. But I think for us, the victory is really that we become the first African country to access LEN. And I think it will shift the landscape completely. It will shift, I think, the fears. It will shift our perspective around HIV. I think we will really look at it. We'll look at it, and it will just be like,
Yeah, a thing of the
a
past.
thing of the past. And I think that's so wild, but it's so wild to think about it
In our
like that.
lifetime,
In
you're
our
right. In our lifetime.
Who would have thought?
Mm.
Who would have thought, that girls, will be able to prevent HIV in that way? Man, yeah. I think it's so wild just to think about what that's going to do. I mean, it's not going to be an every month thing, twice a year. You get to get your vaccine, and I think it will shift how women's health services are dispensed.
Yeah.
because I mean, for me, women still are at the center, yet at the margin. So here we are.
And I do apologize. I got a bit too excited in terms of pronunciation. It's Lena Kapavia.
Yes.
And I'm still getting used to that, just because it's such a game changer. I think we're the third country in the world that will be receiving such medication. But for those who are watching who would like to know more information, is it an injectable? I know it's every 6 months that you can get it. Is it an injectable or is it a pill? What is it exactly?
So it's an injectable.
Okay.
So you get that one injection every 6 months. I think, one of the fears that a lot of people who are HIV negative have, particularly when people are thinking, one day I would like to have children, you know, whatever a healthy lifestyle, maintain a healthy lifestyle
Yes.
without necessarily needing to, treat after being infected by HIV. I think this gives a lot of hope, because at the time, going back again to the early 90s, late 80s, the biggest concern was around preventing mother to child transmission.
Yes.
And so, what the vaccine does is it especially becomes critical for that. We have a zero chance of transmitting HIV from mother to child, and so it's really a big win, in terms of preventing new infections. Of course, we take, there's a lot of behavior change work that is happening on the ground, but in terms of, a watertight
Yes.
intervention, the vaccine definitely is it.
Sure. And how amazing is that? Again, just the journey, to know that people will be able to access such. I'm so excited because there's two parts to it, as you were saying. It's preventative rather. But not only that, if you are HIV or AIDS positive in that manner, you can as well use the medication. And so I love that as well, where people, like you're saying, if you want to start a family or whatever the case may be, but just that sexual freedom, your
Yes.
freedom to live a healthy life, is incredible. And from where we've started, you're talking about the 90s, early 2000s, so many people had stigmas around even being sexually active. Can you imagine as an adult wanting to be sexually active, wanting to start a family and being scared to do so, in case you'd be infected.
In fact, it was a threat. So your mom would
Yes.
tell you, if you play with boys, you get AIDS and you will
Yes.
die.
Yes, and it was used in that man, and you are so right. But also just shout out to everyone who is HIV and with AIDS as well, positive in that light and living positively. More
Yes.
importantly,
Yes.
you did that. You really have empowered yourself by taking the right medication. It's been such a journey. I mean, I think about my aunt, and how she's lived for so many decades now. We weren't even sure that would be happening. And so many people that I know personally who even sometimes make the joke of saying, hey, we're healthier than you, which is true because they check up on their health. They go to doctors. They're more aware, of what's happening in their body. And just to see that,
Yes.
for me, is such a win.
Yes. I think it's one thing, when you talk about it in an abstract way to say, you can actually live healthy and it's on paper, we see it on pamphlets, on TV adverts. But I think the most powerful demonstration of the fact that you can live healthy is our immediate families, You have family members whose spouses passed on, late 90s,
Yes.
who live on to their 70s.
Yes.
See their grandchildren, take their children through varsity,
Yes.
get to just celebrate, the gift of life. And it's not even a thing, It's you have your medication and you're living your life. I think, we talk about the vaccine, Nandi, but even for people who are living with HIV right now, one of the measures that the Department of Health has made possible is getting, the 6 multi-month dispensary. So you get to get your treatment, collect your treatment twice a year, so you can collect your medication for a 6 month period, and you don't have to keep going to the clinic and stand in those long queues. You can live a healthy life. You have the freedom of not thinking like, oh, every last Friday of the month I must go collect my medication. So we have that as well. And I think the incentive, I mean, for has been particularly for people who've been able to consistently take their medication, even to a
Yes.
point where the virus is not detectable. So I think everyone gets to benefit from a healthcare system. And I think a big shout out to the National Department of Health. The
Definitely.
Minister of Health, Dr. Erum Twaledi, has
Yes.
really been at the forefront of ensuring that our healthcare system is really the cream of the global south. And so I think it's amazing.
And it goes back to that political will where we saw very dark times, particularly in that like 99, 2004, where there's just this denialism and people
Yes.
were desperate for medication. To see now where we have ministers like Dr. Aaron Motsoaledi saying, no, let's do this. Let's take it on. Let's see how people live a better life. And just for South Africa to be the first as well, to access the lenacapavir medication is a huge milestone. It's massive, and just shows just the mentality towards such and the positivity towards such, and seeing our people win in such a great way. I love that. And just for Southern Africa as a whole as well, there's so much progress you're seeing with the numbers. Can you believe at some point I remember KwaZulu-Natal being one of the top regions in the world, with the new infections, and to see how the numbers have gone down, it's so exciting, it's liberating. And I'm just so happy for you, everyday person, that they can access such medication. And we have to be proud of that.
Yeah, absolutely. And I think for me, it's also the amount of work that has happened on the ground.
Yes.
So we have and that's where it becomes a whole of society approach, as government likes to say. So you have the department leading on, getting medication to be accessible, but there's a lot of work that is happening in communities through community-based organizations. I mean, at the time, there was a lot of home-based care. I mean, there still is quite a lot of home-based care organizations that are working, particularly in the Eastern Cape and in KZN, who are doing a lot of incredible work in terms of just, caring for and pushing the messaging around HIV and addressing issues of stigma and so forth. And so there's a lot of social mobilization that is happening on the ground, young people, peer education that's happening in schools, in healthcare facilities. Soul City has work that we are doing around social mobilization, having youth care clubs, having, interventions where you get young people not to just be passive participants of what's happening. So I think there's a lot of sectors and a lot of players who've made this possible. Parents who've been able to speak to their children, teachers. If you have a child, I mean,
Yes.
when my son started grade 1, you can never say anything wrong. You can never say anything wrong about their teacher. The teacher says everything the teacher says is the gospel. And so when you have teachers who have the right messaging and are pushing that messaging to kids, you see then the kind of change that we want to see. Yes, medication is accessible, but that child that has access to medication still has to be in a class where they are being ridiculed by other kids. And so everyone has really played such an important role to get to where we are today. So it's not just the fact that people are living healthy, it's also that people are free, they're not afraid,
Yeah.
to be stigmatized, for having HIV. Healthcare workers are so, empowered in terms of how they treat patients despite the pressures. And so I think everyone has really played such an incredible role.
I love what you just said because it's so true. I just think of my aunt again, who then became an HIV AIDS counselor. Proudly so, should wear her badge, But like you're saying, on the ground, so many people took an active role to just try help everyone, especially the stigma. She would speak proudly about how she's positive and living positively as well. And it reminds me, we were at an event for the Gates Foundation, and an incredible woman spoke about her story being HIV positive and how in her village she had inspired so many other women, not only to live a better life, and get the right medication, but also just to take that stigma away. That you can live a beautiful life, a positive life, this great life, a glorious life. You deserve it. And if you see her in all her glory, she's living such a great life. And so you are right, where there's so much work, like you're saying, Soul City, the Gates Foundation, many people on the ground, abo auntie, abo malume, and we
Yes.
thank you for those watching. Thank you so much for all your work. You are seeing it. I mean, if you think 20 years ago, where we were to now,
Yeah.
who would have thought?
Who would have thought? Who would have thought? And again, the most powerful advocate for me and ambassadors for that would be people that we know, people that are in living in our communities. Nothing beats that for me.
Nothing beats that. I love that so much. Okay, so where to from here? Because I'm re-energized once more just listening to you. I'm gonna give this feedback to Antoine as well and everyone watching, guys. Where to from now? What would you love to see? Just in terms of HIV/AIDS, we've made so much progress, but what are your hopes?
So I think for me, medically, I think we've advanced. So, we've technologically we've advanced. An app can tell you that you need to take your medication now, eat now, so that you take your medication now, and that's great. But beyond that, I think it's that shift in attitude. So around, sexual behaviors amongst young people, you don't have to, you can leverage your liberty to contribute a lot more to society. There's a lot more that we can do amongst, young people. So if people have access to medication or other preventative, biomedical interventions without a shift in attitude, I think that will continue to be a problem. And so there's a lot of work still around behavior change that needs to happen. So we cannot just say, there's family planning, options that you have without a shift in attitude and how we behave. And that again for me, that recognition that individuals in society, particularly women and girls, stand at multiple intersections. So you are a woman, you are a mother, you are poor, you are unemployed, you have chronic chronic medical issues, you have a disability, maybe you're a migrant. So there's so many intersections that one person can sit at. And so when we think about, either prevention or response, we still need to take into account that it's not a one size fits all. you are uneducated. So there's all those multiple layers that one has to
Sure.
navigate. And I think for government, for civil society, even for private sector that's wanting to, play an active role. We see on Mandela Day, there's a lot of painting that happens, but I think there's a lot more that we can do that shows that we see people. So we see you. And that's what Ubuntu is. I see you as a person, not just in terms of how I want to see you, but I can see exactly where you are, and I'm willing to come to where you are
Yes.
and walk together from where you are, and not, at least bring you up to where I am, and we start walking this journey. So we've come from far, but we still have a long way to go. Yeah.
I love what you said, because there's a level of accountability that we all have to take for our own lives. And
Absolutely.
as much as I'm saying, I see you, it's important for me to see myself
Yes.
and value myself and do right for myself, by myself as well, And I think those are the issues as well, because yes, we can try to find solutions, but I think what's important is to do the internal work as well. And I think South Africa is in a place where we are aware of what we've gone through, the trauma we've gone through, particularly when it comes to Black people, my people, African people, and I think we just need to spread that awareness. The same awareness you're talking about with HIV AIDS, that look, this is our past, and this is Southern Africa as a whole. What can we do now to look internally and do better for ourselves, for our communities, because you are right. That's when you'll really see a lot of progress as well. When we empower ourselves in that light, where we look at ourselves and say, well, yes, this is my body. My body's definitely a temple, How do I navigate with this beautiful body that God has given me in this world? And my passion is teenagers and the youth in general. And so that's what I hope for every single female and male to feel empowered and to do right for themselves, because they have a bright future. Africa, has the biggest youth population. You guys, if there's any young person watching, you guys are powerful in the world. And what does that look like? And how can you change the future, not only for the continent, not only for the country, but for yourself? How does that look like? And I know because we advocate for mothers on the show, I know that's what every mother wants for their teenage son or daughter, to live a good life, and also young adults, if you are engaging in sex, how does that look like? Are you doing it responsibly? How would you like it to look like, And to be practical as well, But what I can tell you is that life is long but short, and every decision impacts your life, whether positively or negatively, and that's what we should be sharing as well. And thank you so much for bringing that up. You truly care. I can see advocating for young people, but just women in general as well is something that's very close to your heart.
No, definitely. I think the fact that we're sitting here today, two Black women, having this conversation, the way that we are, is such a powerful, powerful demonstration of where we are. And again, bringing it back to what you're saying around, as a young person, are you doing this responsibly? We're no longer just raising young people to become, employees or someone who just makes managers. The demographics that you're talking about that show that, by 2050, almost more than half of the world's population are African, and more than half of those people are young people.
Yes.
What does that mean? How do we equip them to lead, to shift the trajectory of what, politics, what the health sector looks like, what agriculture looks like, what construction looks like, inclusive financial services. And so it's more than just, the one health issue. And so I'm so excited for Africa's future.
Oh,
It's
it
exciting.
is
It's
exciting. It's
exciting.
so exciting. And I mean, you saw the beginning of this episode, it just felt somber when you think of the past,
Mm.
and where we were and how we're smiling now, just excited about the future. And I think for any mother watching this is to know that like our kids hopefully will make the right decisions, but they are the future of the world,
Yes.
not just the continent. They are the future of the world. And that's so incredibly empowering. I cannot thank you enough for your time.
Thank you for having me. It's
Yes.
been such a great
It
conversation. We
really
could
has.
go on.
And on and on. Look, you're a mother of two as well.
Yes.
A 19-year-old, a 12-year-old.
Yes.
What do you like to share with them? And not only with them, but any child, any young person watching this as the future of this world.
I think, growing up, a lot of people would say, you'd be asked, so what's your ambition? What do you want to be when you grow up? And a lot of people would say, I want to be a doctor, a lawyer, a pilot. And I think what's exciting for me is, I mean, my own kids, my nieces, nephews, young people, that I engage with, is their dreams are far bigger than that. The world is literally their oyster. They don't have to write to pen pals and try and imagine. So what does this country look like? They'll tell you things you have no idea. And I think so. They have a lot more, at their disposal. And I think the world is literally their oyster. And so
Yes.
for me, my own hope, for my kids is that they lead. They lead in the world. Because they literally have it all, yeah, at the tips of their fingers. So I think young people, there's a lot that they're having to navigate and confront, but there's also a lot that they have on their side, that we could have never dreamt of. Just yesterday, I was reflecting on my grandmother, in a conversation I had with her when I was 7. I mean, I don't know how I remember that, but I was just thinking of how far we've come. That she could barely write her name in her 50s, but here we are. I mean, we are literally our ancestors' wildest dreams, but I think our children will go far, much further than we could have dreamed. And yeah, it's just amazing to me.
That's so true. African child, it is possible. But I love what you said. You will lead. African child, you will lead. Thank you so much for sharing those words. And you're right, there's been so much progress. We're seeing with the HIV/AIDS, but we're seeing it just in general for the African child, for the African mother, father, just family and as a whole. So what a great way to really and truly, I think, celebrate World AIDS Day, just the progress. Yes, there's still work to be done, but how far we've come. And to anyone living with HIV/AIDS, may this be an episode where you feel empowered, feel seen. Thank you as well for shedding light on just living positively. There's so many people who are living positively. And for those who still have the stigma, hey man, it's never too late to turn your life around. I've seen so many people do it. You deserve a great life. No matter what the story is, you deserve a great life because you only have one life. So from the Motherhood Network, we'd like to thank you all for joining us here today on World AIDS Day. Can you believe it?
Wow. Wow.
Hey?
Wow.
Wow. What a time to be alive. And thank God that we can be alive.
Yes.
Thank you so much.